Nyeri Town constituency, we had the Nyeri Town Sub-County Triple Threat Edition in partnership with the National Syndemic Disease Control Council. The National Syndemic Disease Control Council is a parastatal that was put together in the later years of President Uhuru Muigai Kenyatta's reign, in recognition that we had some areas that were related but were not well coordinated. Early teenage pregnancies, which were neglected because they were not happening within the family setup, and the family was looked at under the family health unit. The new incidences of HIV infection and gender-based violence. Today we added the component of drug and alcohol abuse and mental health, because the 5 components are one of the biggest social problems in Nyeri County. The suicide cases in Nyeri County are some of the highest. The new HIV infections among the youth, yet Nyeri Town is literally a youth urban area because of the presence of our youth from Dedan Kimathi University, Nyeri National Polytechnic, KMTC, Kenya School of Agriculture, and now the new kid on the block, the Outspan Global University. And therefore we asked ourselves, how can we get this conversation going? The issues of gender-based violence, including rape, incest, and indecent assaults, starting with the death of baby Tamara, and with the recent case which we are covering, where we had a young lady dismembered. This points to a bigger social problem, and therefore today was the beginning of our conversations as a community. We invited all the Nyumbakumi and community health promoters in Ruare Ward. Then we invited all the small-scale trading sectors, their leaders, to a meeting. Then in every church that has a youth congregation or a youth church group, we invited the leaders of the church groups. Across the entire sub-county, we had 366 young people. Then for every polling station, we invited between 4 and 6 people. So we were able to cover the entire constituency. The data on GBV was presented by Sergeant McKenna, who handles the GBV desk at the Nyeri police station. The data on alcohol and drug abuse was presented by Caroline, who is the regional Nakanda coordinator. The data across the 3 sectors on alcohol, early teenage pregnancies, and new HIV infections was presented by the regional coordinator of National Diseases Syndemic Council. The Nyumbakumi and the chiefs were led by the Assistant County Commissioner. After those data were presented, we requested that the leaders who were assembled, 1,000 of them, become champions of ensuring that this conversation does not die at the end of this meeting. Of great note and achievement is one of the CHPs, who is also a person living with HIV, came out, and we have agreed unanimously that she is going to become our HIV champion, a lady by the name of Subira. This country, we seem to have shifted into the politics. But the people we are pulling into the politics are suffering. Illicit alcohol in Nyeri Town. Now Nyeri Town is not struggling with bangi. It is struggling with injectable drugs. Last week, we had a young man who was a border rider who actually passed away after injecting himself with heroin in an artery instead of a vein. And if we leaders continue thinking about the political parties, thinking about who will be and who will not be elected in 2027, we are failing the people who put us into leadership. I am happy today that Nyeri has had an opportunity to speak. I am told it has come out clearly that there are people who are involved in drugs and illicit alcohol trade who are being called the untouchables in Nyeri, who are telling people, you speak about this and your life is on the line. Today we have said this is the last time that conversation will happen in Nyeri town. And I'm happy that the president is in our region on Monday on coffee matters in Kirinyaga. I am promising the people of Nyeri that this conversation we've had today will reach that table. Not that the president is unaware, he is aware. But some of our areas are suffering more than others, and Nyeri town is one of them. And I want to request that all of you members of the press, as we cover some of these occasions, please continue to highlight the burden of illicit alcohol, the burden of drugs. You walk into Wetemere, and the people in Wetemere, all of them can be able to tell you, so and so, I don't know Kuria, I don't know who, they mention them by name. But apparently, those of us who are in leadership pretend that they do not know these names. It is not possible. And people cannot cry out to people in power, and people in power pretend that they are unaware. And I just want to request that the leadership of this region, please get off the rooftops of the vehicles. Our region is suffering. We used to complain of illicit alcohol, being transported from Kariobangi and Thika. Now illicit alcohol is being brewed in every urban center. After the last raid associated with the Mudodio, I am told now the manufacturing concern has shifted. It is somewhere in Chaka, it is somewhere in Nyarifo, it is somewhere in Gatito. This fight is bigger than we think, and unfortunately, the manufacturing now will not be tackled by putting roadblocks on the road. The manufacturers have shifted to residential areas where our people are staying. And that is why we decided to convene the entire constituency. A person who is in leadership, put in that leadership position by the community as the community organizes itself, and just to try and have this conversation. And I am happy that after sharing the data, people are unanimous that unless we work together, we will not change this. The proposal that we form a team of HIV champions who will talk to our children in our schools before they become teenagers and tell them the danger. If that happens, we will not only be able to tackle HIV, we'll also be able to tackle a bit of teenage pregnancies. We'll also be able to tackle the issue of drugs. On parents, some of our children are doing the things that happen in our homes. We are the ones introducing our children to sex early in life. That has come out clearly. Children are learning about sex in their homes because their parents are no longer discreet about sex. We've been told about those of us who are living in plots that are gated, and how we leave our children to play with the watchmen. And the watchmen are introducing our children to pornography at the gate. So the conversations have been deep. I am happy that this was not about blaming the MP or blaming the national national government administration office, all blaming the police. It was just a call for action. And really today is one of those days when I have participated in a community engagement where there was no one term, there was no two term, there was no political party, there was no personality. It was just about our welfare as a community and a problem that is actually going out of hand.